Hi, this is Emma, Noah, Emily, and Jan, and today we'll be talking about non-Hodgkin's lymphoma.
And today we're going to be talking about the disease, causes, diagnosis, risk factors, prevention, and prognosis. So to start off, what is non-Hodgkin's lymphoma? So non-Hodgkin's lymphoma is cancer that originally starts with one's lymphatic system. This usually starts off with a tumor that is developed from a certain type of white blood cell called lymphocyte. Lymphocytes are cells that are part of one's immune system and helps fight off any infections or viruses from the body. And so the causes for, non-Hodgkin's lymphoma, it usually starts off with a mutated gene cell, sorry, and it starts making off replications. And so we have two causes, which is our T cells and B cells. T cells are cells that are involved with killing any foreign objects, and it is actually the least common cause, but there is actually treatable despite being the least common. And then next we have B cells, and B cells are cells that help aid in fighting off infections by creating antibodies to help fight off and neutralize, any foreign invaders directly. And actually, with B cells, it is actually the most common cause that causes non-Hodgkin's lymphoma.
All right, so next we're going to be talking about diagnosis as well as the symptoms and how the disease can present itself. So typically for non-Hodgkin's lymphoma, like Jan said, it is a cancer of the lymphatic system. So a very common systemic symptom that we're going to see is swollen lymph nodes because those are the primary infection sites. So yeah, we're going to see swollen lymph nodes, and then other symptoms that can present themselves but are not always present are lack of energy or fatigue, as well as unexplained weight loss, fever, and or night sweats, as well as other localized symptoms. So for example, if somebody was experiencing a cancer of the lymphatic system, specifically in the axillary region, which is like in the lymph nodes of the armpits, they may experience skin conditions in that area, as well as soreness in their arm and effects of the functioning of their arm. So in terms of diagnosis, with many cancers, as well as non-Hodgkin's lymphoma, you're often going to have the performance of a biopsy, which is where cells from a lymph node or a tumor that are affected are going to be removed and analyzed under a microscope. And then we're going to look at the characteristics of those cells to see if there's abnormalities and if there are cancerous cells present. So that's going to be the primary form of diagnosis for the specific cancer. And then other diagnostic tests include blood tests, bone marrow exams, and PET and CT scans. And these diagnostic tests are going to be mainly in determining the severity and the staging of the cancer. So seeing if it has metastasized and seeing what the survival rate is going to be, what the prognosis is going to look like.
Risk factors and prevention. So risk factors are behaviors or features that increase risks for a certain condition. The prevalence of non-Hodgkin's lymphoma has been shown to be higher in individuals, primarily of those people who are age 60 and higher. Race is another factor that comes into play, with white people having a high incidence of the disease when compared to that of other races. A person's sex is another factor that can increase the risk of non-Hodgkin's lymphoma, with a majority of those with the disease being male. Genetics is another unmodifiable risk factor that can lead to increased risk of having this disease. The prevalence of non-Hodgkin's lymphoma is one family can be a large risk as to developing this disease in the future. Partaking in risky health behaviors such as smoking and binge drinking are modifiable risk factors that can greatly influence one's chance of getting this cancer. There's no surefire method as to prevent someone from developing non-Hodgkin's lymphoma, but there are ways that may reduce your chances. By preventing infections from diseases that make the body immunodeficient, such as HIV or HLTV1, the proper strength of one's immune system will be better able to combat this cancer and possibly prevent it altogether. One of the best things that a person can do is maintain a good overall health. So things like maintaining a healthy diet, achieving adequate levels of physical activity, and refraining from partaking in activities that can be detrimental to one's health can really help to reduce the chances of developing non-Hodgkin's lymphoma.
Next, we will talk about the prognosis or the likely course of non-Hodgkin's lymphoma. The overall 5-year survival rate is 72% according to the American Cancer Society. One thing to consider is that there are more than one type, meaning survival rates can differ. Additionally, the prognosis depends on the stage at diagnosis. These stages come from the SEER database and include localized, regional, and distant stages. These statistics are just a baseline because the prognosis is individualized is unique to the individual. Some factors that are not included into these statistics include age, health, how far the cancer has spread, and how the cancer is responding to treatment. Two common types of non-Hodgkin's lymphoma include the more common diffuse large B-cell lymphoma and follicular lymphoma. Diffuse large B-cell lymphoma has a survival rate of 64% to a rate of 89% for follicular lymphoma. Follicular lymphoma is considered slow-growing, and while typically not curable, is treated as a chronic disease. Treatment for this type is based on the severity of symptoms and how rapidly the cancer is growing. Diffuse large B-cell lymphoma is aggressive, but considered potentially curable. Since the advancement of this type is quick, it requires immediate treatment for the best prognosis. A combination of chemotherapy and Rituxan with possible radiation therapy can lead to remission in a large number of patients.